get settled on a medication and be doing really well, and as soon as we switch manufacturers, they are not doing well anymore. I can think of my own mom who, has trigeminal neuralgia. She's on oxcarbazepine. She was doing so good on one, and they switched the manufacturer, and it was no longer controlling her trigeminal neuralgia. So now she requests that, manufacturer only. And we see that all the time in retail pharmacy. That one worked really good for me. That one didn't work for me at all. What is the difference? Is it I don't know, but there is something there that says certain manufacturers and certain manufacturing processes work better than others, or maybe it's the purity of the product. But certainly patients from their own experience, and from my family, from my own experience, certain products, generic products, work better than others. So it's very nice when you can find a product that works well for everybody, that no one would have an allergy or issue with, and that you won't have to keep swapping out. You won't have 3 different bottles on your shelves from different manufacturers because one works better from one patient than other. It was inventory to keep putting product on.
You make an interesting point. Generic companies are always, collectively as an industry, our goal is obviously to provide high quality medications at affordable price, or increase accessibility, because that's the whole reason why generic industry was formed. But as you said, there are variability, and you made a comment earlier, which I think is important, because the reality is that the buying practices, or the drug flow practices, 1 month it could be one manufacturer than others. So with the variability of inactives across different products, patient could be doing well one month, and next month having more challenges. And obviously that's the nature of the opportunity. So when we think about levothyroxine capsules, is that it's meant for a certain portion of the population that really has tolerability issues. You look at the end of the day, if a patient's tolerating a tablet very well, so when you find that you have a patient that is not being tolerant on levo tablets, how do you really go about? Is that going back to physician, because if they're going to change on to something else, they're going to redo testing? And how's that process work when you find that a patient is struggling and doesn't want to take the medication? You determine it might not be other outside factors. What's that process look like?
Well, they come to the with the problem. Find the product that doesn't have that inactive ingredient, and then it's easy. You just make a call to the doctor's office or fax over and ask them for a different